Some children may disobey, argue, or talk back to the parents or teacher. Did you notice it? Myself, Sukumiii, I am the student of occupational therapy. It is a normal part of development. So, disargue and refuse to the parents or teacher is a normal part of development to the toddlers which have age 2 or 3. So, they want something, some toys. They having temper tantrum and they want this and they disobey the parents like this. But it should integrated. It should end in some age. If it continues, then it is called Oppositional Defiant Disorder (OD). Children has hostile behavior, which means oppositional behavior. If I say something, they talk exactly opposite to that, and they don't cooperate with us. So they have uncooperative behavior. These leads to make a negative impact in their social life, family life, and academic life. What is conduct disorder? It means the children have some behavior. This behavior violates the social norms, which means the person acting antisocially. So this is called conduct disorder. This ODD may leads to conduct disorder because during an argument the person focus on only their thoughts. They don't compare the other thoughts and they never stop the argument. They always want to struggling and arguing. So this behavior maybe leads to conduct disorder. What is the cause for this ODD? There is no known cause. There is no known biological basis for this ODD. Some children having the risk for getting this disease. What are all the risk factors? First, parental rejection. The parent don't reject their child. So if the parent reject their child, the child may disobey and starting oppositional behaviors that leads to ODD. Inconsistent child rearing. What is rearing? The parenting is known as child rearing. So we have to stand in front of the child and we have to show how the child can behave. So that is called child rearing. It is also known as parenting. So it should be supervised manner. So it should not be unsupervised manner. It should be consistent. If it is inconsistent, the child may lead to have the ODD. Giving more punishment, giving limitations, limit setting to the more areas, and providing discipline to the children, limiting the child may lead to the ODD. Parent showing defiant interactions. So if the parent interacting with the other person with a defiant way, which means he does not obey to the person. So that's like that. So the child viewing this, so and the child may develop this skill. So the my parents is not obeying, so I am not obeying. So that's like the child may develop their behavior. It leads to ODD. Family conflict in front of the child. So if the family members are all doing argument and doing disobey, so these are all seen by the child. So we have to avoid family conflict. So it may lead to the what are all the signs and symptoms shown by the child having ODD. These symptoms should not occur in one setting. So if in school only the child act like this, it is not ODD. In home only the child is act like this, it is not ODD. In all settings, home, school, and where are all the place the child goes, in all these places the child should show these symptoms, then it is ODD, oppositional defiant disorder. The child may disobey directly. So directly by not following the rules. So directly by not following the rules. Or indirectly. How indirectly disobey? So the child may procrastinate what we are saying or something like sneaky personalities. So this like the child may indirectly disobey. With some persons, a child may be closed, being very touchy, and suddenly the child may show annoying behavior, irritating behavior to them also. The child may get frequent anger and showing resentment in birds also. So toxic is brain has some toxic is shown by the child may have temper tantrum, stubbornness, vindictiveness. It is the character of taking revenge to the person. That is called vindictiveness. The person may showing unknowing. So the person may have irritation to the others. So the person don't understand others' feelings, don't have empathy, violating other rights. So if the child is doing misbehavior, does not accept she is the mistaken person, and he blames his mistake to the others. What is the treatment for ODD? I already said ODD leads to conduct disorder. We have to stop the progression to the conduct disorder. So that is the first goal of treatment. So to treat the child, we have to use psychotherapy and anger management techniques to the child. Parents also need some training programs how to communicate with the children. So the communication should be strong and it should be positive between the parent and the children. Then only the child can be improved normally. If the children has more anxiety or depression, we can use drug therapy also. Give medication to the children to reduce the symptoms of anxiety and depression. And for therapists and nurses, controlling him is a very big task. So it is not a easy task. So they have temper, so temper tantrum. So that's all not easily handled. So we have to control in a brain using way and in a physical using way also. Thanks for watching. I know this video maybe give information to you. So please subscribe. I also need motivation.